My name is Diana, and my ethics in healthcare presentation is about autonomy and therapeutic privilege. Who really decides? The background for my ethics paper includes a 70-year-old Pakistani woman with limited English proficiency, or LEP. She came to the United States, where her children currently live, to be evaluated for masses on her armpit and neck. This evaluation brought forth a new diagnosis of B-cell lymphoma. B-cell lymphoma being a hematologic malignancy uniformly fatal without chemotherapy. The family, more specifically the eldest son and his wife, asks the physician to withhold this information. Their reasoning being the patient cannot physically or emotionally handle the diagnosis. The patient's eldest son and his wife believe she cannot physically handle chemotherapy because of her advanced age, and that she cannot emotionally handle the diagnosis because her sister had died from the same diagnosis 6 years prior, despite receiving rigorous chemotherapy and treatment. The family asking the physician to withhold the information of the new diagnosis brings forth the problem of therapeutic privilege, also known as therapeutic non-disclosure. This is defined as the withholding of relevant health information from the patient if non-disclosure is believed to be in the best interest of the patient. The significance of the topic heavily revolves around the amount of patients with limited English proficiency in the United States, as well as the diagnosis of B-cell lymphoma. A statistic from the National Cancer Institute said that the rate of new cases of diffuse large B-cell lymphoma was 5.6 per 100,000 men per women per year, and the death rate was 1.8 per 100,000 men and women per year. A statistic about limited English proficiency that proves the significance of the topic was that currently 1 in 15 people living in the United States have low English proficiency, and it is predicted that this number will increase to 67 million by 2050, placing a strain on healthcare services for these individuals. The thesis statement for my ethics paper is, when all attempts at receiving informed consent and compliance with care from the patient's family have been exhausted, the healthcare professional must observe the ethical principle of beneficence and do what is best for the patient's health. The ethical principles that are in conflict in my ethics paper are autonomy and beneficence. Autonomy is self-governing, or the patient's right to make choices for him or herself. The 70-year-old Pakistani woman in my paper was determined by the nurse practitioner and the neurologist to have decisional capacity, and therefore she should have her own autonomy. However, through therapeutic privilege and therapeutic non-disclosure, this autonomy is being barred by the patient's family. A concept that is crucial to note for this paper. The other ethical principle is beneficence. Beneficence is the physician's need to do good and do what is best for the patient. The physicians, in this case, know that the patient needs treatment. I defined B-cell lymphoma in the background slide, and from the definition, one can see that it is a diagnosis that needs treatment and needs chemotherapy. Therefore, beneficence is more important in this case. Laws, codes, and duties that apply to this case can be found at the local, state, and federal levels. The case did not specify in which state it took place, so I did these based on Illinois for the local and state levels, both of which include the Illinois Public Health Medical Patient Rights Act. This lists patient rights such as sound nursing and medical practices, the right to examine medical bills or charges, which could be relevant to this case because of the use of interpreters and how that would affect costs in any way, if it would, and the right to privacy and confidentiality, which is also relevant because of the discussion of therapeutic privilege or therapeutic non-disclosure. At the federal level, we have HIPAA laws and orders, which as future healthcare professionals, it is very important that we note. HIPAA lists laws such as the HIPAA Privacy Rule, Human Subjects Research Protection, and the HITECH Act. The CDC is also important, and the CDC Paperwork Reduction Act compliance is crucial for future healthcare professionals. This ensures quality and reduces public information collection burdens. This slide is rather short because of the abrupt ending to the case. The resolution of the controversy or outcome of the case was that the family, being the eldest son and his wife, eventually leave the physician's office with the patient, not having the physician disclose the information of the new diagnosis. They continued to deny follow-up care and continued to ignore calls from the clinic. Of the proposed solutions for the future, in regards to the problems presented by this case, the use of translators from the start of a patient's care proves to be the most important. This meaning to not rely on the family for important communication such as revealing a diagnosis. Various types of translators are listed in Table 1 on the right-hand side, labeled Sources of Language Assistance for LEP patients, remembering that LEP means Limited English Proficiency. This table shows the type and description, the advantages and disadvantages of each type of language assistance that can be provided in the hospital setting. At the bottom, we can see the bilingual family member or friend, which, in our case, the patient's eldest son and his wife acted as this, an affiliate who self-reports bilingual skills. Disadvantages to this that are seen clearly in the case are the last two bullet points, potential role confusion, and that they may impede frank discussions between patients and physicians. This is shown in the therapeutic privilege and non-disclosure argument, as well as potential role confusion with barring the patient's autonomy and evidently not giving the patient her right to choose what to do by withholding the information of her diagnosis. Therefore, a solution for the future would be from the start to resort to a professional in-person medical interpreter or telephonic medical interpreter or a video medical interpreter, as well as a bilingual clinician. The conclusions or main takeaways from this presentation include noticing the importance of both ethical principles defined, autonomy and beneficence. As future healthcare professionals, it is crucial that we recognize the importance of all ethical principles, and having to define both of these was both helpful but also proved to be challenging because I had to make the decision of which was more important in the case. It is also important to note how laws, codes, and duties can provide a framework that guides how physicians and healthcare professionals are able to treat patients. The most important takeaway of them all is that as future healthcare professionals, we must ensure that we are providing proper support for all of our patients, especially patients who may need it more, like patients with limited English proficiency who need services such as translators. That concludes my ethics presentation.